Back in the days, about 15 years ago, 20 years ago, the transgender community's chances of being employed is very, very low. I mean, that's not the case these days. I mean, we're pretty much accepted. Back then, it was very hard for someone like me to get employed. So, you know, I was unemployed for a very long time. And I guess that's one of the factors that got me into one of these housing apartments, which I, you know, to now I'm really appreciative of. As you can see, I've looked after the property, and yeah, so that's what happened. That's how I got into this area.
I came from Potts Point, and I had a job which I lost, and it really hurt me to have lost that job. I was very, very disappointed and very frightened for my future. I was just so frightened and ashamed, and you know, all the awful things that happen when you decide, or when I decided to try to get a housing home. Look, I'll tell you right now, I think this is the most stable housing I've ever had. I have never had this sense of community before.
I was so surprised when I came here because people had told me Waterloo was a dreadful place. And I came here in fear and trembling. They told me it was the drug capital of Sydney and the criminal capital, and it was, you couldn't walk in the street by yourself. And I heard all this and I thought, oh, well, what can I do about it? So I came here. Then I met the community, very nice people, some people still working. You know, some people who'd held really quite interesting jobs throughout their lives. And I thought, oh, this is a wonderful place to live.
People are here not by choice, they're here by circumstances, and there are many different circumstances why they come into these places. And we have in Waterloo here some extraordinary people. We have people from China who are elderly come out here as parents, and they were doctors, medical doctors. We've got one man here from Russia as a refugee come here a few years ago, who was a scientist in physics. You know, we've got many people with PhDs down here. There are people who are engineers, school teachers. You can pick just about any profession. There's a large number of very intelligent people down here, but by circumstances, they're in public housing. You look at the last global meltdown, how many people were working, corporates, managers, and you know, some of them committing suicide. Some of them lost all their superannuation. And once they lose their job, they can't get back into it. They bring younger people in for it. I can understand that, but there is no jobs for people. Where are they going to go? They go on an age pension, and then they live in public housing because that's all they can afford. Nobody on a pension can go out there and private rent. It's impossible, literally impossible.
Before COVID, you know, I was either working long hours at International Airport, or after that I would be going to the gym and spending most of my nights there and just coming home to rest. But since COVID, you know, I haven't been employed. We all got stood down, and I didn't have much to do until I saw all these people lining up downstairs to get their free food, and I thought, you know, I've done a lot of volunteering in the past, so I could be useful.
There will always be elderly people and people of circumstances who don't have the luxury of being, grew up in wealthy families or well-educated families, that there'll always be poor people or low-income earners, and they've got no hope of being able to buy a house today because of the way prices are. And if we don't start facilitating something and set something up for these people so there is a future for housing for them. You're going to have more and more people living on the street, and people getting depressed they can't get a job because they can't afford the rents in the area where the jobs are. The welfare bill's going to grow higher and higher. Depression will set in, they'll go on the drugs or become alcoholics, mental health gets worse, and that's where you can see what's happened.
We got letters in our letterbox, and I went to get the letter and I was just like, oh no, not again, you know.
We all remember the opening sentence about how excited the minister was. The excitement, the metro, and then you'll all be relocated.
It is frightening when you realise, oh, I don't have any power over my house, which I love. It's not actually my house, but it really feels like my house, if that makes sense.
For a lot of the people, they can't even walk. Some of them are bedridden, and some of them need the hospitals nearby. I mean, what are they going to do if they get moved somewhere else? And a lot of them have formed relationships, real close relationships with each other, and it'll be a real shame if they all get separated, you know.
There are a ratio of the demographics of what's going to be built down here. One is social housing, affordable housing and private. 70% private, 5% affordable and 30% social housing.
Somehow the presence of all these private owners will raise the social level of the social housing people. Somehow this will magically achieve the changing of them to a better sort of people, which was actually said at the time, a better sort of people.
The towers that they're proposing are just horrifying. I don't know who's going to be in them.
I know it's a picture of what people think of as a modern city, and in some ways I feel it's very forbidding.
I feel like there is very little care for what we want. Well, there's none. There's just a grab for money, and it makes me want to cry.